Hello, I'm Dr. Azaz from medicovisual.com, back with the next part of the visual lecture series on peripheral nerve fibers classification. So previously we had classified the nerve fibers of spinal nerves as well as the first 6 cranial nerves. Now let's start our discussion with the 7th cranial nerve. Now the 7th cranial nerve is also the facial nerve. Actually, its name is facial nerve, so it is the facial nerve. Now, most important thing about this nerve is that it will supply the muscles of facial expression. So it is supplying the muscles of facial expression. Now these muscles are basically derived from not from the somites. They are derived from pharyngeal arches. So basically they are derived from the second pharyngeal arch. So it means that we have discussed already that the fibers that are supplying the nerve fibers that are supplying the muscles derived from pharyngeal arches, what should we call these fibers? We should label these fibers as, first of all, of course, they are efferent fibers, but they are not somatic efferent, they are visceral efferent. So we call them visceral efferent, and they are not ordinary, they are special visceral efferent. We have already discussed these things in detail, so I'm not going into details again. And another simpler class naming scheme is that we should simply call them as branchiomotor fibers rather than this confusing terminology of special visceral efferent. We can simply call them branchiomotor fibers. So first type of fibers that are inside the facial nerve are special visceral efferent or branchiomotor fibers. Second most important thing about the facial nerve is that it is not just related with the face and facial expression. Actually, we have our beautiful tongue as well, and this tongue has some taste fibers, and the taste fibers at the interior two-third part of this tongue, these taste buds, the taste buds at the interior two-third of the tongue, they are supplied by this very nerve. They are supplied by this very nerve, the facial nerve. And fibers that are taking the taste information, the taste sensory fibers of taste, these fibers, what should be named? How should they be named? Of course, first of all, we will simply call these fibers as afferent fibers. Afferent fibers, because they are taking sensory information towards the nervous system, so they are afferent fibers. But next question is that whether they are visceral afferent or whether they are somatic afferent. So here I have put that our beloved flow chart here, algorithm. Actually, we have placed this algorithm, and we will try to answer these questions, and then we will find out that whether they are visceral efferent, not efferent, afferent, whether they are visceral afferent or whether they are somatic afferent. So deeply seated viscera, is the tongue very deeply seated? I don't think so, especially the interior two-third is not very deep, isn't it? So it's relatively much superficial, so it's not a deeply seated viscera. My answer would be no. Is it part of GIT? Is it part of urogenital respiratory or CVS? Well, actually, I believe, well, not just I believe, many people, most of the people believe that it is the part of GIT, especially taste buds. They are important component of, not important component, they are only way to check the taste of the food, and that is the part of GIT, of course. So the answer should be yes. So it's a part of GIT. Are they chemical sensors? Yes, they are chemical sensors. Our taste buds are chemical sensors. Whatever we eat, basically, that these are the chemicals, and from these chemicals we detect that what taste is this. For example, if there is sodium chloride, that would stimulate the salt sensing taste buds, and we will feel that there is that salty flavor inside our mouth. And if there is that monosodium glutamate amino acid is there, then we will feel that okay, that's an umami flavor and so on. Basically these are chemical sensors, nothing more than that. And what is the embryological origin? Well, embryological origin is a bit controversial. Some textbooks says that the interior two-third part is ectoderm, while most of the articles and most of the textbooks, they believe that the taste buds, they originate from sublanchnopleura, which is endoderm, right? Actually endoderm, they originate from endoderm, and endoderm is basically the part of sublanchnopleura. So this one is the most common one, and this one also some people believe. And what is their nuclei arrangement? Basically they are arranged in a column of other visceral fiber, special visceral efferent fibers, so that is with other visceral. So if we look here, other than this, every answer is going towards this side, and this side is the visceral side. So the answer is straightforward, that they are visceral efferent fibers. And of course, taste and tongue taste fibers, actually they are unique. Well, this reminds me of a story. One of my newly married friend came to me and he said that, Dr. Azad, I bought some flavored condoms, but I am now very angry because my wife couldn't taste the flavors of that condom. Then I explained to him that the vagina does not have taste receptors. This is for the oral sex only. The flavored condoms, they are for the oral sex. If you have taste buds on your tongue, you have taste buds on the back of your pharynx, some taste buds the pharynx as well, but not in the vagina. So you cannot taste with the vagina, you cannot taste with your hand and other parts of the body. So it's a unique and rare sensation, that is why it's a special sensation. So it is special viscerally, friend. So two types of fibers up till now. We have discussed the taste fibers as well as we have discussed the brachiomotor fibers. Two types of fibers we have discussed up till now. The facial nerve is not that simple. It harbors some other fibers as well that we will just discuss. So besides the taste fibers, we also have some fibers that are supplying the lacrimal gland of your eye, as well as the sublingual and submandibular glands. These are the salivary glands, sublingual and submandibular, and this is related with eye. So these three glands, they are also supplied, and we have discussed previously that glands, they are always supplied by visceral fibers, visceral efferent fibers, and basically there is nothing special about them. So here we will label them as general visceral efferent. So third type of fibers are general visceral efferent fibers that are there in the facial nerve, and some small amount of fibers, they are also supplying the some part of back of your ear, general sensation to back of the ear. And of course these general sensation are touch, pain, temperature, vibration, etc. So such type of sensation back of external ear, such type of sensation are carried by which fibers? We have discussed already, they are carried by general somatic afferent. So we have general somatic afferent, general visceral efferent, and we have these special visceral efferent and brachiomotor fibers in the seventh cranial nerve. Now if we talk about eighth cranial nerve is which nerve? Vestibulocochlear nerve. Vestibulocochlear nerve mainly consists of single type of fibers, basically afferent types of fibers, sensory fibers, right? So afferent fibers from the two parts of the internal ear, basically the hearing part as well as the balance part. So vestibulo part, which is the balance part, and cochlear part, which is the hearing part. So from both of them there are these two divisions of vestibulocochlear nerve which combined to form the single vestibulocochlear nerve. So first of all, of course, they are afferent fibers, right? So whether they are visceral afferent or whether they are somatic afferent, to determine this, again let's put this algorithm here and let's try to answer these questions one by one together, and then we will come to know that whether they are visceral efferent or not efferent, visceral afferent. I don't know why I again and again call them efferent. They are visceral afferent, visceral or somatic afferent. So let's find out. First question is that whether it's a deeply seated viscera. Well, I believe that the ear, basically you have that skull, and inside the skull in the middle ear, in the sorry middle cranial fossa, deep inside the middle cranial fossa, you have these somewhat here in the petrous part of temporal bone, somewhat here there will be the internal ear. So I think it's a deeply seated viscera, isn't it? Some people might think it's a no. If you only think about external ear as only or middle ear, then you might be thinking, okay, it's not a deeply seated viscera. But actually, the fibers are originating from the internal ear, isn't it? So fibers are originating from the deeply seated viscera. So my answer would be yes. Then is it a part of the system? Well, no, it's not a part. Are they chemical sensors? No, they are not chemical sensors, they are mechanical sensors. So my answer would be no. What is their embryological origin? We have discussed it in detail in the development of ear, that their embryological origin is somatopludic, and they are lying with other somatic in the column of other somatic viscera, somatic fibers, right? So clearly this goes towards somatic nerve fibers. So these are the afferent fibers, but they are somatic afferent. They are somatic afferent, and they are of course special somatic afferent. These are unique sensations. These are the special sensations which are carried by these fibers. So naturally we should label them as special somatic afferent fibers. So mainly one type of fibers are there in the 8th cranial nerve, and these are the special somatic afferent fibers. Actually, I'm not feeling very well. I have this sore throat, so my voice would be slightly changed. I'm sorry about that. You have to bear with me. Anyhow, by the way, I will cut the coughing part in the post production. I am coughing throughout in this recording, so I will remove the coughing part in the post production. Anyhow, let's talk about the 9th cranial nerve. And 9th cranial nerve is glossopharyngeal nerve. Glossopharyngeal. As the name indicates, it has actually two parts. Glosso mean tongue, and pharyngeal mean it is related with pharynx. So tongue part, as well as it has tongue part, as well as it has pharyngeal part, right? Pharynx part. So yeah. Now if we talk about tongue part, basically it is taking the sensation from the posterior 1/3. Basically we discussed that from the anterior 1/3 the taste fibers are carried with the help of which nerve? 7th cranial nerve. Yeah, by the way, I remember one thing. Before going into detail of this 9th cranial nerve, let me tell you something interesting. You know, the taste fibers from the anterior 2/3, they are carried with the help of facial nerve. But what about the other fiber? For example, if someone touches on your tongue, or if someone like grab your tongue and move your tongue forcefully, then what sensation? This sensation will be carried from which nerve? Actually, these common sensations, these general sensations, they are carried through the 5th cranial nerve. So these are carried, touch, pain, temperature, vibration, etc. These type of sensation, they are carried with the help of 5th cranial nerve. 5th cranial nerve, as we have discussed already, that these general sensations from the head and neck region, including the tongue, they are carried with the help of 5th cranial nerve. Now here is the interesting thing, that these sensations, they are taken from the tongue But these sensations are taken with the help of which fiber? General visceral afferent or general somatic? Interestingly, they are carried with the help of general somatic afferent fibers. Why? Because these sensations, these are basically the extrapolation of sensations that are carried from the skin and from other superficial parts, and from the same fibers which carry the sensation from the skin and other superficial part. These sensations, touch, pain, temperature, sensation from the tongue, they are carried from these same fibers to the same nuclei of fifth nerve. That is why these are general somatic afferent. So if we are talking about the touch, pain, temperature sensation, then we will say that these are carried with the help of general somatic afferent. But if we talk about the taste sensation, then they are carried with the help of visceral afferent fibers, and these are unique sensation. These are not general sensation. They are carried with the help of special visceral afferent fibers, right? So now let's come to the again to the tongue, and now we will discuss about the glossopharyngeal nerve. And we have discussed that glossopharyngeal nerve has the glosso part, and it is related. Why it is named so? Because the taste sensation from the posterior part of the tongue, posterior one third of the tongue, it is carried with the help of ninth cranial nerve. So here these fibers will be taking sensation from the posterior one third of the tongue. Within, they will be going, of course, within the this glossopharyngeal nerve, the ninth cranial nerve, and similar to anterior two third, these in this posterior one third, they are also the special fibers, and these are special visceral afferent. Again, I am not explaining these things again because it is exactly the same as in case of seventh cranial nerve. Now I will speed up the lecture a bit because it would be more of the revision right now, so there won't be, most of the things will be repeated now. There won't be any new things. There might be some, then I will explain those, but mostly it will be the repetition. So second type of fibers is that it is also supplying the stylopharyngeus muscle, which is formed by the which is formed by pharyngeal arch, and I guess third pharyngeal arch. Let's check it out later. So it is formed by the pharyngeal arch, and the muscles that are derived from pharyngeal arch, they are innervated by which fibers we have discussed already. Yes, they are innervated by special visceral efferent fibers or brachiomotor fibers. Again, nothing new. I'm just repeating the thing. So second types of fibers are special visceral efferent, which are supplying the single muscle, that is stylopharyngeus muscle. Then we have third, that we have general sensation from posterior one third. Now general sensation, for example, touch, pain, temperature sensation from the posterior one third of the tongue. From anterior one third, it is carried by the trigeminal nerve, fifth cranial nerve, but the taste fibers as well as the general sensation, touch, pain, temperature sensation, they are from the posterior one third of the tongue. Both sensation, they are carried by glossopharyngeal nerve. But as we have discussed already, the taste sensation, they are general. Yeah, we have discussed here, they are special visceral afferent. But the general sensation, as again we have discussed previously, they are general somatic afferent. Nothing new here, they are also general somatic afferent. Now here a relatively newer part of discussion will be the fourth type of fibers. These are very important fibers, and let me draw here. We have, the carotid artery. This is the external carotid part, and here there is the bifurcation of common carotid, and here is the initial part of internal carotid. Okay, so this is the initial part of internal carotid, sorry. So here is the common carotid. This is common This is external carotid, and this is internal carotid. So now actually here we have a special structure here. We have, this is called so this is the special structure here. This is called carotid body. This is a body that is called carotid body. Actually, carotid body is involved in, it is present near the bifurcation, basically in the posterior part of bifurcation of common carotid artery, and its function is that this is basically the pH sensor. So basically it's a pH sensor. Along with that, we also have this dilated part of internal carotid artery, which is actually sensing the blood pressure. These are stretch receptors here, baroreceptors here, right? So here both of and yeah, by the way, this dilated part is called carotid sinus. So we have carotid body, which is related with pH sensing, and carotid sinus, which is related with blood pressure sensing, right? And fibers from both of these, they will be taken up, they will be carried by this glossopharyngeal nerve fibers will be the going into glossopharyngeal nerve, right? And these nerve fibers, what are they? Of course they are afferent fibers, but whether they are visceral or somatic, that is the question. So let's try to find out, and again let's put our algorithm here. Yeah, so let's put the algorithm, let's decrease it in size a bit, and now let's try to answer these questions. So are they deeply seated viscera? Yes, they are deeply seated viscera, right? Although not very deep. Carotid artery is not very deep. Your answer might be no if you think about it, but I would go for yes, right? Basically these things are subjective, right? So there is not clear cut objective answer to them anyhow. And secondly, are they part of the system? Yes, they are part of cardiovascular system. My answer would be yes. And by the way, even if you consider this no, most of the other answer will be towards this side, so that is why I'm already telling you the answer. This will be visceral. And are they chemical sensors? Well, if you talk about the carotid body, then definitely it's a chemical sensor. It is pH sensor. It is the sensor of hydrogen ion concentration, right? But if we talk about these baroreceptors, the carotid sinus, I don't think so that they are chemical sensor, but these are basically mechanical or stretch sensors, stretch receptors, right? And embryological origin is subplanknopleura, and they are lying with other visceras. Not other visceras, I mean their nucleus is in the column of other visceras, right? So of course it's a clear cut yes, except this one in case of the baroreceptors, the carotid sinus. Other than that it is yes, so it is going towards visceral. So these are the afferent, these are visceral afferent, right? So these are visceral afferent. Now, are they special or they are general? This is important question. Actually, these are not unique to the carotids. Actually, in the aorta, there are aortic receptors as well, aortic body and aortic sinus, and there are some other similar structures present in the body that is not clearly known, and I won't go into detail. So it's not very unique according to some people. It's not very unique. These are not very unique organs, but some authors believe that these are unique organs. For example, R.J. Last, author of anatomy, he considered them as special visceral afferent, but most of the authors, they consider them as general. They consider them as general visceral afferent. Again, some authors consider them as special visceral afferent. I know it shouldn't be so much subjective, and so much there shouldn't be so much discrepancy in this type of classification, but it is what it is. What can I say? ideally there should be some standardization here, but when we study the literature, we see that some books they consider them general visceral afferent, other they consider them as special visceral afferent. Especially the prominent example is RJ Last Anatomy. So that's how it is. I think these are all these fibers we have in the ninth cranial nerve. So we have four type of nerve fibers in the ninth cranial nerve. Now next is the 10th cranial nerve, and the good news is it's the vagus nerve, and it's the vagus nerve that is not the good news. The good news is that the vagus nerve has all these same fibers as the ninth cranial nerve. For example, we have the special visceral afferent. We have special visceral afferent fibers. 10th cranial nerve also have special visceral afferent. It's just that their area of supply is different, right? So in case of ninth cranial nerve, the area of supply was the posterior one third of the tongue, but in case of 10th cranial nerve, it is the part of pharynx. Basically, it is taking the taste sensation from some part of epiglottis and soft palate. There are some very small amount of taste fiber in these areas as well. So special visceral afferent. Then we have the special visceral efferent in both nerves, the ninth and 10th cranial nerve. In case of ninth cranial nerve, that was supplying the which muscle? Stylopharyngeus. But in case of 10th cranial nerve, it is supplying the laryngeal muscles. And which laryngeal muscles, I won't tell you. You have to study yourself. And again, if you want to learn those things, we will learn in the neuroanatomy, not today. So next is we have the general fibers, general somatic efferent fibers. In case of ninth nerve, that is the posterior part of the tongue, but here we have the ear, some part of ear, basically external auditory meatus and external auditory meatus, some part of external ear, basically external auditory meatus, as well as tympanic membrane. And by the way, here let me tell you another important thing. Where it is. So I said that general sensation from posterior one third of the tongue, it is carried by glossopharyngeal nerve, right? And by the way, also from the pharynx as well, it is carried by glossopharyngeal nerve. Now, most of the authors consider it general somatic efferent, but some authors say that because it's a part of deep viscera, we should call it general visceral afferent. Although it is touch pain temperature sensation, which is not usually the visceral sensation. These are not visceral, these are not typical trademark visceral sensations. Visceral sensations are, the visceral pain and the stretch and all these things that we have discussed previously. But even though they are similar to somatic, but because they are deep viscera, we should call them general visceral afferent. But other authors say that no, it's a part of extrapolation of those superficial sensations, so we will label them as general somatic afferent. So again, there is discrepancy in the literature, and what can I do? I will just mention those discrepancies, and you have to decide which path you have to follow. The fourth type of fibers that we have in the 10th cranial nerve, these are the general visceral afferent fibers, and these are coming from the aortic and aortic sinuses and aortic sinus and aortic bodies. These are similar to carotid sinus and carotid bodies that we have discussed previously. And the fifth type is general visceral efferent. So general visceral efferent, it is providing the motor innervation to lots of viscera throughout your abdomen and pelvis, and that is why this is called vagus nerve. Vagus means wandering nerve. It originates from your brain in the what is that, in the brain stem, but it goes all the way to the abdomen and pelvis, so it is wandering throughout your body. That is why it's the wandering nerve, and it supplies a lots of viscera that we will not go into detail. And regarding the general visceral efferent, I remember that we also have general visceral efferent here as well. General visceral efferent in the ninth cranial nerve as well, that I'm sorry I forgot to mention. And you know that the submandibular and sublingual glands, these are basically the salivary glands, they are supplied by seventh cranial nerve, but there is the third one as well. Third one, the salivary gland, is the parotid gland. The seventh cranial nerve does not supply the parotid gland, so ninth cranial nerve will say, okay, dear parotid gland, you don't feel lonely, I'm here to supply you. So of course ninth cranial nerve also have general visceral efferent fibers as well. So now let's talk about, we have discussed the 10th cranial nerve, now let's talk about 11th cranial nerve. So 11th cranial nerve is also called accessory nerve. Accessory nerve. Its name is accessory nerve. Yeah, so basically it's a pure motor nerve and it has two parts. It's a pure motor nerve. It means it's a purely not afferent, efferent. So it's purely efferent. I mean it contains purely efferent types of nerve fibers. So basically it has two parts. If we draw the medulla here, so here there is pons and here is the medulla, and of course spinal cord as well. It is continuing as the spinal cord. Now actually some fibers originate here from the medulla. It is forming the cranial division of 11th cranial nerve here as well, bilaterally. So let's not draw it here, I have just shown one side. So it's a cranial division. Then from the spinal cord, in the cranial part, cranial regions of the spinal cord, some nerve fibers originate and they will combine and they will form the spinal division of 11th cranial nerve. So both of these divisions, they will combine to form the 11th, this is our beloved 11th cranial nerve. So this is the 11th cranial nerve, which has two division, the cranial division as well as the spinal division, right? Now if we talk about cranial division, it is very clear cut and simple that the cranial division, it supplies the muscles of larynx along with the 10th cranial nerve, which is also supplied the muscles of larynx. Some muscles of larynx, they are also supplied by cranial division of 11th cranial nerve. And these laryngeal muscles, as you know, that they are derived from pharyngeal arch, so these fibers are naturally special visceral efferent or branchiomotor fibers, right? It's very simple and clear cut. But the situation is slightly tricky when it comes to the spinal division of accessory nerve. Now actually the spinal division of accessory nerve, it supplies two muscles, the sternocleidomastoid SCM, we can simply write it SCM, as well as the trapezius TPZ. So these two muscles, they are supplied by spinal division of 11th cranial nerve. Now here is a catch and here is a problem. These muscles, some people say that, actually not some people, some research says that, research article says that these muscles, they are derived from somites. These are somatic in origin. Some research says that no, they are not somatic in origin, they are derived from pharyngeal arches. And then there is some research that says that These are not completely derived from pharyngeal arches. Their connective tissue is derived from pharyngeal arches. So now the problem is that their origin is not clearly known. So how can we classify them? Actually, again, here is the discrepancy. Those people who follow this thing, who follow this research that they are somatic in origin, they label these fibers, these spinal fibers, as general somatic efferent fibers. Simple as that. But those who follow these two, they label it as special visceral efferent or brachiomotor fibers. So that is again a discrepancy. But along with that, here another evidence that favors towards this special visceral efferent type of naming scheme is that it is not just about the origin of these, but also if I draw the spinal cord section of spinal cord for you, let me explain this thing for you. That here is the section of spinal cord, a very rough diagram, sorry about that. So here we have so here we have the section of spinal cord. Now these spinal fibers, they originate from here, somewhat here, right here as well, from here, not from here, not exactly, although they are originating from the ventral horn of spinal cord, but they originate at the lateral margin of ventral horn of spinal cord. Actually, in the cranial region of spinal cord, we do not have this typical lateral horn. We do not have lateral horn, so naturally they cannot originate from the lateral horn. So they originate from much lateral part of ventral horn, although from the ventral horn, but extreme lateral part of the ventral horn. So some scientists argue that these are similar to the visceral efferent fibers that originate from the lateral horn, but since there is no lateral horn in this cranial part of spinal cord, in the basically cervical part, it's not technically, it is cranial, but it is actually technically named as cervical part. So in the cervical region of the spinal cord, we do not have lateral horn, so they do not have choice, so they originate from the lateral most part of ventral horn. So this thing also favors towards the special visceral efferent naming. So in a nutshell, it's again a confusion. Some people say it's a general somatic efferent fiber, some people say it's a special visceral efferent. But if we talk about the cranial division, it's very clear that these are special visceral efferent fibers. Finally, if we talk about the 12th cranial nerve, 12th cranial nerve is basically supplying the voluntary muscles of the tongue, and these muscles, they are originating from somites. So it's very simple and straightforward that they are labeled as general somatic efferent. Like other somatically derived muscles, they are supplied from the general somatic efferent, and again it's a purely motor, purely efferent type of nerve, so it is supplying the general somatic efferent. It has only the single type of fiber, which are general somatic efferent fibers. So now let's have a quick review of cranial nerves. We have already discussed these things, but let's have just a quick review. If you want to skip this part, you can skip, but if you want to have a review with me, you can still hang on and you can continue to watch this lecture. So if we talk about first cranial nerve, the first cranial nerve is related with sense of smell, and which fibers it is carrying? It is carrying the special, let's draw it like this. It is carrying the special visceral afferent, or some authors, they also like to call it special somatic afferent, and these are basically the smell fibers, olfactory fibers, right? And second cranial nerve, it is related with your eyes, basically the vision. So it is carrying the special somatic afferent fibers related with vision, right? And then we have the third cranial nerve. Third cranial nerve has two types of fibers. One is the general somatic efferent fibers, which are supplying most of the extrinsic muscles of the eye except two extrinsic muscles of eye. And along with that we have general visceral efferent fibers, which are supplying the sphincter pupillae muscle. Sphincter pupillae. Then we have the fourth cranial nerve. Which is containing only single type of fiber, which are general somatic efferent, which are supplying the muscles, one muscle of the eye, which is superior oblique muscle. Then we have fifth cranial nerve. Fifth cranial nerve is taking the general somatic afferent senses from head and neck region, right? Head and neck and head and face region. And we have the special visceral efferent or brachiomotor fiber from the first arch derived muscles. Then we have sixth cranial nerve, again only single type of fiber that are supplying the somatic efferent fiber, which are supplying the lateral rectus muscle. Then we have which nerve? Seventh cranial nerve. Which has lots of fibers actually. It has a special visceral afferent, which are taking the taste sensation from anterior two-third of tongue. Then it is harboring the special visceral efferent to muscles of facial expression and some other muscles as well, which are derived from second pharyngeal arch. Muscles of facial expression and other muscles as well. Then it has general visceral efferent towards the lacrimal gland, sublingual and submandibular, right? Then it has the general somatic afferent to some part of ear, behind external ear, some part of skin behind the external ear, right? Then we have eighth cranial nerve, which is carrying the special somatic afferent fibers towards cochlea and towards the vestibule, from vestibule and cochlea actually. Then we have ninth cranial nerve, and ninth cranial nerve, it is carrying the special visceral efferent from taste fiber from posterior two-third of tongue. Then we have special visceral efferent towards the stylopharyngeus muscle, which is also derived from pharyngeal arch. Then it has general somatic afferent from posterior one-third of the tongue. It's not two-third, I written it wrong. It's posterior one-third, right? Posterior one-third of tongue and I guess some part of pharynx as well. Then it has the general visceral efferent, or some people call it general special visceral efferent from carotid and carotid body and carotid sinus, right? Then it has the general visceral efferent fiber, which are supplying the parotid gland. And the 10th cranial nerve, it has very similar fibers, just the distribution is different, that we have discussed already. I think we can skip it for now. And talking about 11th cranial nerve, it has two types of fibers, special visceral efferent towards the laryngeal muscles and towards the trapezius and sternocleidomastoid. These are the, either they are special visceral efferent or they are general somatic efferent depending upon the reference that you are following. And then we have the 12th cranial nerve, which is supplying the muscles of extrinsic muscles of the tongue. It is the hypoglossal nerve, and it is the harboring the general somatic efferent fibers. So I think that was all about these cranial nerves. We have already discussed these details. Finally, let's review about the special ones. I mean the special visceral, special somatic, and so on. But let me have a break here. I will cut the portion of break and then I will get back to you. Now, if we talk about the special fibers briefly, let me write it here. So basically, we have some special fibers, and of course, they can be special somatic or special visceral, and then they can be special afferent or special efferent. So let's write it here. We have actually, yeah, so we have actually special. First write the afferent one. So we have special somatic afferent, and if we talk about special somatic afferent, here let's go to this diagram and let's see what sensations are carried by special somatic afferent. Actually, according to some people, smell, but most of the people consider it as a part of special visceral afferent. So vision is the part of it, and of course along with that, balance, hearing and balance. Where is that? Yeah, hearing and balance. So sensation carried by it is smell, not smell can be, but mainly vision and hearing and balance from the eighth nerve. Hearing and balance. These are the part of special somatic afferent. And here, if I write smell, I can put a question mark here. Then we have the special visceral afferent. So if we go to that diagram again, that table, we have the special visceral afferent. We have smell sensation, which is again slightly question mark, but most of the people consider it as special visceral afferent. Then in the special visceral afferent category, what else we have? We have the taste fiber from all of the tongue. This is the anterior 2/3 as well as the posterior 1/3 as well. So taste fiber are here. In the special visceral afferent we have taste fibers. So yeah, taste fibers are there. Anterior as well as posterior we have taste fibers. Then these pH sensors and the baroreceptors, some people consider them as special visceral efferent, pH and BP sensors, baroreceptor sensor, but again it's a question mark. So smell, taste, and what else is here? I think that's all that is here. Let's look it carefully. I hope I'm not missing anything. Yeah, I think that's all. Now let's talk about efferents. So we have special visceral efferent first, because it's an easier to explain. Special visceral efferent, and this is related with brachiomotor fibers. These are the brachiomotor fibers to pharyngeal arch muscles, pharyngeal arch derived muscles, right? And then we have the last one is the special somatic efferent. Now this is interesting. I've deliberately written it here, and the interesting thing is that if you look here, you will not find, by the way, it is called SSE, so the acronym is SSE. Now if I try to find where is SSE here, there is no SSE here, isn't it? So what's going on? There is no SSE, there is no special somatic efferent anywhere. Well, that's actually true. There is no No SSE. It does not exist according to many authors. According to many authors, again, it does not exist. But as usual, there is some discrepancy here as well. So most of the authors consider them that they do not exist. There should be no special somatic efferent fibers, right? But here, some people believe that these are special muscles. These muscles of the eye, they are special. So this should not be general somatic efferent. This should be, they are derived from somites. So of course they are somatic efferent, but it's a special somatic efferent. So they also label it as this one as special somatic efferent, this one as special somatic efferent, and they also say that muscles of the tongue, they are also unique. So they should also be considered as special somatic efferent. So according to most people, they do not exist. But some people classify muscles fiber that are supplying muscles of tongue plus muscles of eye, external muscles of eye. Some people label them as general somatic, not general somatic, I mean special somatic efferent, right? And third one is another interesting point, that some people consider that here with the special somatic afferent there are some special somatic efferent fibers as well. And what are those? That is again interesting thing. Actually, within our ear, especially in the cochlea, some efferent fibers are coming from the brain, and basically they modulate our sense of hearing. And I guess some fibers are there in the vestibular part as well, but I'm not sure about this. And these fibers, because they are efferent fibers, but they are coming towards that special organ ear, and they are somatic, so some people consider them as these ear fibers as special somatic efferent fiber. But again, it is very controversial, and if you want to follow the majority, then you should go with this concept, special somatic efferent. And regarding the general fibers, I will not tell them again. You already know these are very easy and simple. But special fibers, I have put it here again so that you can follow this and you can understand them properly and have a review as well. So I think that was all about today's lecture. I hope you learned something. Thank you so much for watching this video. Have a great day. Goodbye.